This is Molly Gilmore. She is a dietitian at Clarinda Regional Health Center in Clarinda, Iowa. Hi, Molly.
Hi, Heidi.
How did you decide to become a dietitian?
Well, I had several options I was thinking about, but I decided that I wanted to go into healthcare in some way because I wanted to help people. And I also had a strong love for food and nutrition, gardening, cooking, baking, those types of things. So I decided to combine those two, and that's what led me to dietetics.
That's awesome. What other alternatives were you considering in high school?
I considered pharmacy, so another medicine or type of medical profession, and nursing. I'd also considered landscape architecture.
Oh, wow. Okay. And would you alter these decisions if you were making them today, or would you have continued on this career path?
I would not alter the decisions. You know, I had a lot of time to think about that, and so going through college, you had time to change some things, but when you get into some classes you really enjoy, I knew that this was the right choice.
And what are the duties of your job, Molly?
Well, right now I work at a hospital, so I do a lot of clinical work. So I see patients who are in the hospital to try and help them with their nutritional needs. I see outpatients that the doctors refer me to. I also teach a kids garden class and help with the menus at the hospital.
Okay. What is your favorite part of that job?
My favorite part is just the interaction with people. Being able to help people, whether it is they're sick right now, or maybe they're dealing with a lifelong disease, or maybe it's just teaching little kids how their food grows. Just being able to help them in some way is the best part about my job.
That's awesome. And what are some things that frustrate you?
Frustration is, of course, I'm a dietitian, so people lie to me all the time. So that's a little frustrating. And it's hard sometimes because people dealing with these diseases, you know, they're in a state of frustration and concern. So trying to help them sometimes is frustrating as well.
Right. Okay. What kind of training or education do you need to be in a position like yours?
You have to go through 4 years of college and get a bachelor's degree in food and nutrition. They call it dietetics. And then you have to complete an internship after that. And there's lots of different dietetic internships you can go to. You apply for them and they pick you. And those can range from anywhere from 6 months to 2 years. Some of them are coupled with a master's degree. But you have to go through your internship and take a national exam to be a registered dietitian. And then if you want, you can go on to get your master's as well.
Do you feel that your training adequately prepared you?
Yes, I do feel like my training adequately prepared me, but I also feel like my work experience while I was going through college helped as well.
Okay. And how do you coordinate your family and your home and your job responsibilities?
Well, it's crazy, like every parent knows, but my job is fairly flexible. So a lot of times healthcare professions now are fairly flexible in terms of hours. A lot of dietitians will work maybe 4 days a week, or nurses will work 3 12-hour shifts and then be off for 4 days. So having that flexibility allows me to make it home for dinner every night, get to my kids' events, and just kind of manage my work and family life pretty easily.
Okay. And what is one piece of advice that you would give a high school student who's preparing for the workplace?
My piece of advice would be to get some experience, whether it's work experience or volunteer experience, maybe in the field that you're thinking about, because actually doing something is going to give you a better view of what that's going to entail than just reading about it in a book or learning about it in school. So if you're able to volunteer or get a job in the field you're looking into, I think that's the best thing you can do.
Awesome. Thank you so much, Molly.
Thank you.